Hi, welcome to week 3. One thing before we start, do you notice at the top of your screen where it says Curriculum Development Centers Program? I'd like to share with you that a lot of the content in this slide was developed by the Office of the National Coordinator for Health Information Technology. Several years ago, the federal government put extensive funding in the development of a core HIT program that could be used by multiple institutes and educational associations across the United States. And the goal was to get more people into the workforce with skill sets in health information technology. All academic programs were welcome to use this program as it was developed, but the government actually paid for the curriculum to be developed, and then they actually paid people to take this curriculum and go to school so that they could become certified. So much of the content is from that curriculum combined with information from your textbook. Okay, so week 3, we're going to talk about delivering healthcare, and this week it's about accreditation and professional organizations. These are the objectives as listed in your course guide. You need to understand the role of accreditation, regulation, and professional associations, and also how the Affordable Care Act also impacted these organizations. So healthcare and accreditation. Basically, once you get the government off the table that we talked about last week, there are agencies that develop standards for the delivery of healthcare services. Now, accreditation from these agencies is voluntary, and it's also in addition to any federal requirements. Because you are accredited does not mean that you do not have to meet the federal requirements. You still have to do that. But people seek accreditation because it means that you have what is called a deemed status. And a deemed status can actually replace a scheduled review from the state or federal government site visit. A deemed status, as I like to say, is something you can hang your hat on because it shows that you've gone above and beyond what was required by the federal regs, and you went that extra step to do the work, to get accredited, to have an outside agency come in and say, hey, you do good work. So what we're going to look at today is the Joint Commission and the URAC. These are both nonprofit accrediting organizations. We're going to look at other regulatory agencies and then touch on professional associations. So the Joint Commission is very important because you're going to hear nothing but the Joint Commission says all throughout this program. The Joint Commission, the history, was started in 1910. It's the forerunner of this is the end result. It went under many different names, but in 1951, the Joint Commission on Accreditation of Hospitals was formed, the JCAH, and it started accrediting and certifying healthcare organizations. Then in 1987, the name was changed to the Joint Commission on Accreditation of Healthcare Organizations, and it was called JCAHO. And when you get out working and you work with older people like me, you're going to hear them call it JCAHO because that's what they grew up with. But today, they changed the name, they simplified it to the Joint Commission, or JC. So it currently accredits and certifies more than 18,000 programs in the United States. Here's its mission that you can read over. Mission statements is the guiding principle of which they live by. And the Joint Commission accreditation, when it's earned by the entire healthcare organization. It can be earned by a hospital, nursing home, a surgery practice, whatever. The tools that they use to measure performance of that organization is called an Integrated Survey Process, or ISP. And it'll evaluate the total performance of that organization. They also have a system called ORIX. And ORIX is directly related to the information technology aspect of that. So hospitals are required to collect data and transmit it to the Joint Commission for patients with certain conditions. So maybe that condition is congestive heart failure. So when they transmit that data in the ORIC system, the Joint Commission is evaluating the quality of care and the outcomes for that patient. So not only can you be accredited by the Joint Commission, you can participate in ORICs to help determine quality outcomes. So a hospital could choose to provide data on various conditions such as heart attacks, pneumonia, outcomes of psychiatric care, whatever it is they want to report. Now, I've said it once, I'll say it twice. Joint Commission accreditation is voluntary, and that is what a quasi-independent body performs an institutional review that evaluates the quality of the facility's work process against pre-established written criteria. By quasi-independent, it means it's independent, it's not regulatory, but they have a lot of power and they have a lot of standards and regulations. So they'll have like a pre-established written criteria. For example, operative reports have to be written within 1 day of the surgery. They will actually check to see if it's done. The criteria for the Joint Commission, and they call their criteria standards, often mirror the regulations that are established by the CMS. And remember, the CMS from last week is called, the criteria is called the conditions of participation or conditions of coverage. So the rules that the CMS publishes in the Code Federal Register are called the conditions of participation. So you get a deemed status. You go to the Joint Commission, you get that deemed status. It demonstrates that you're compliant with the conditions of participation. And what outcome is, you may reduce site visits from your state and federal agencies. Of all the accreditation agencies, the Joint Commission is the most well-known and it is the leader. The ORICs, as I mentioned earlier, common measure sets for ORICs include heart attacks, pneumonia, inpatient psych care, children's asthma, and stroke treatments. So each core set has performance measures, and those are listed like a check mark. Did you do this? Did you do this? Did you do this? So the Joint Commission would look at whether children with asthma received the right kind of drugs in the hospital, and was that child sent home with a management plan so they would not have another acute attack. Joint Commission certification. Joint Commission accredited organizations and providers can also earn certification for specific programs or services. So let's say you have a healthcare facility and they are known for their treatment of chronic diseases or conditions. They might get certified for treatment of that disease. They might be a certified center for the treatment of diabetes. Or maybe you have a healthcare facility that's known for orthopedic surgeries like knee replacements and hip replacements, and they have good outcomes. They may get certification in that specialty. Programs for certification can be within a medical center or it can be in a community. The other thing the Joint Commission does, they're really big on patient safety activities. So they have national patient safety goals for healthcare facilities to strive to. They have universal protocols for all healthcare facilities to follow. They have Office of Quality Monitoring to see if people are following their efforts that they do. They have a Speak Up program if you see something wrong or if something happens that you can call them. But the one that you need to know and the one that's in the program is called the Sentinel Event Policy. Okay, the Sentinel Event Policy. So a sentinel event, that returns to anything that's unexpected in an organization. A sentinel event is something that's just not supposed to happen, like someone died and they weren't supposed to. Or someone suffered a serious physical injury and they weren't supposed to. Or a psychological injury. Or a risk of such event. Those kind of events, sentinel events, require immediate investigation and response. So for example, a sentinel event might be someone goes in to get a below-the-knee amputation and they amputate the wrong leg or the wrong side of the body. That is immediately reported to the Joint Commission. The URAC, I'm going to let you just read that and know about it and what it does, But remember, the Joint Commission is the most well-known. URAC, they're known for the Accreditation of Information Technology Compliance. And that one you can read over. Now, the other accreditation agencies that are out there that a facility may choose to do, you have the Accreditation Association for Ambulatory Care. Naturally, they accredit only ambulatory care facilities, which is outpatient. You have the Accreditation for Commission on Healthcare. You have the American Association for Accreditation of Ambulatory Surgery Centers. You have the American Osteopathic Association Healthcare Facilities Program, or HAFAP. And you have Community Health Accreditation Program. The one that's most known or well known around the area is the CHAP, or the Community Health Accreditation Program. So that could be like a home health agency might choose to get certified. Another one that's out there that wasn't listed in this course but is listed in your textbook is CARF, and that's Accreditation for Rehabilitation Facilities. Regulatory agencies, they're public authorities at the state or federal level, and they're established by the legislature to enforce standards in a specific field. So when you have an agency, a regulatory agency, and they create a standard, that regulation that they create is equivalent to a law. So that agency can conduct hearings on any violations, and they can hand down judgments. The ultimate goal is consumer protection. So this is getting back to the federal government a little bit. So for example, the federal or the Food and Drug Administration is a regulatory agency. Anything rule that they publish, their regulation is the equivalent of a law. And if it is violated, they can do a hearing and they can hand down judgments and punishments as they see fit. So here's an example of the FDA. And here's the mission of the FDA. Okay, so we're running a little short on time. So we're going to go into professional organizations. Accreditation is voluntary. Accreditation works in a healthcare facility. A professional association is a nonprofit organization that wants to support a profession or the interest of individuals who work in that profession or the public interest. So a professional association will set requirements for entry into that profession. So you might have to be licensed or you might have to be certified to be a member of that organization. Members generally have to have a certain amount of education, training, or experience. So for example, your faculty in this program belong to a professional association called the American Health Information Management Association. One other professional organization is the American Board of Medical Specialties, or ABMS. And this slide tells you a little bit about what they do. This one is the big one. It's the American Hospital Association. You can see their membership here and their programs, but the American Hospital Association represents all the hospitals in the United States, and it has a lot of influence in our legislature. It also works to protect hospitals. The American Medical Association is also the biggest. Their membership are physicians. They have to be an MD or a DO, a doctor of osteopathic medicine, or a recognized equivalent. But the American Medical Association represents the interest of physicians in the United States, and it is a resource. So we're running a little bit on time. We got about a minute left. What we talked about today was the Joint Commission, what the Joint Commission does, other accreditation agencies, your regulatory agencies and what they protect, and professional associations. Read your other PowerPoint, read your transcript that goes along with this. You need to know the Joint Commission. You need to know the American Hospital Association. You need to be familiar with the American Medical Association. Thank you, and have fun with your assignments this week.